may not realize it, but virtually all headache types are caused by dysfunction in the trigeminal system, also known as the headache circuit. So if your headaches are migraines, tension headaches, sinus headaches, virtually all head pain runs through this trigeminal system, and thus the trigeminal system is a valuable target with which to try and treat headache disorders. So let's take a closer look at the headache circuit. It consists of the trigeminal nucleus, which is found in the brainstem, seen here in yellow. And there are several nerves, one of which is the occipital nerve at the base of the skull, the supraorbital nerve, which exits above the eye, the infraorbital nerve, which exits below the eye, and the mental nerve, which is in the chin. All these nerves are peripheral points of access that allow us to modulate the trigeminal ganglion, which is deep inside the brainstem. The major chemical associated with the trigeminal system that's involved with headache is something called calcitonin gene-related peptide. This shows the structure of that chemical. It becomes very important in the treatment of migraine. There's emerging research that suggests that calcitonin gene-related peptide is a promising target for the relief of headaches, including migraine. There are a lot of drugs in the pipeline currently in various stages of development that are designed to reduce the concentration of or the effectiveness of calcitonin gene-related peptide in this trigeminal system of the headache circuit. Thus, calcitonin gene-related peptide, and particularly methods that can reduce its expression, are very promising targets for the treatment of head pain. Let's take a look at laser acupuncture, the supraorbital nerve. You can see the acupuncture point to the left of the slide and the actual location on the patient to the right of the slide. Research published in BMC Neurology 2017 of May suggests that 3 months of preventative treatment for migraine with supraorbital nerve stimulation was an effective, safe, and well-tolerated treatment option for migraine patients who did not respond to medications. This is exciting. We can use electronic or laser acupuncture on the surface of the body to, within 3 months' time, provide an effective relief of migraine for our migraine patients. Here's another laser acupuncture point that we use. You can see on the left of the slide here, it's the inferior orbital nerve. On the patient's picture, you can see right below the eye, and these are bilateral points. In a study entitled Acupuncture for Episodic Cluster Headache, a Trigeminal Approach, the authors found that they could treat cluster headache with an acupuncture stimulation applied to points related to the infraorbital branches of the trigeminal nerve. So we're developing a point prescription of acupuncture for headaches involving the terminal branches of the trigeminal nerves, all for the purposes of modulating that activity of the headache circuit deep inside the trigeminal ganglion. This is from the journal Neural Regeneration and Research, 2017 of May. And here we see the gallbladder 20 acupuncture point, which is associated with the occipital nerve, which is another branch of the trigeminal system. And the authors report stimulation of gallbladder 20 relieves migraine pain by modulating the trigeminal ascending system, the headache circuit we've been talking about, in part by inhibiting calcitonin gene-related peptide expression in the trigeminal ganglion. So at the beginning of this slideshow, we talked about how calcitonin gene-related peptide is a hot topic in research into the treatment of migraine and in drug development. Now we see that we can use non-invasive acupuncture on the trigeminal peripheral nerves to modulate the levels of calcitonin gene-related peptide deep in the brainstem and the trigeminal ganglion. This is really good news for our patients suffering from migraine. In other videos, we previously talked about how we can often use laser or electrical or acupuncture stimulation on points far removed from the actual site of the patient's pain. In traditional Chinese medicine, Li4 between the index finger and the thumb on the dorsum of the hand is frequently used to treat headache. And while we don't really know why this has been effective traditionally. Some researchers believe it's because of the location of the sensory homunculus in the brain, where the face and the particularly thumb and fingers are closely related, so that stimulating the acupuncture point on the hand may have a spillover effect and affect the symptoms in the face or the head.